What to do if your partner is depressed, and how do you even know if they're depressed or just having a hard time? Today I'm going to teach you the difference between having a hard time and being depressed, and then my top tips. I'm going to give you 4 today for really moving that needle if they are depressed or even if they're just having a hard time. So let's get to it. I'm Dr. Abby Medcalf. I help people create ease, connection, and love in every relationship. And I'm really glad you're here with me today. So let's talk about the whole difference between sadness and depression. And let me say, first and foremost, I do not love the idea of anybody diagnosing who isn't an actual therapist, doctor, MD, went to school for it. I understand that, Google can teach you lots of things, but it does not teach you what we know from experience and really being with people. And you really don't want to get too far down this diagnosis road. And I'll get to that in the tips of what you should do instead. But let me just kind of lay out there how you can sort of tell to begin with what you're dealing with. Depression and sadness are actually pretty easy to tell apart because sadness, that's a normal, healthy emotion. Everybody gets sad, or everyone should get sad. It's fine to have. You don't want it all the time, obviously, but it's, again, normal, healthy emotion to have. Sadness is triggered by something. Something happens. There's an event, a situation. Your partner said something mean to you. Someone died that you know. Maybe you've moved from a town that you loved living in, but you got a new job somewhere, or your partner got a new job and you have to move, and you're sad. Maybe your pet died. There's a lot of things that can make us sad. And again, but they're triggered by like an outside event. Something happens and then we feel down. Depression is different. Depression doesn't need any kind of trigger. Nothing has to trigger it. It just is. And with depression, everything is sad. Everything is sad. And there's a way of just this very pervasive negative thinking about everything. And one of the easiest ways to tell the difference is that with sad folk, they can, even when you're sad, like even let's say you're something horrible, you're grieving the death of a parent, something really bad. Your partner's grieving the death of a parent they were very close to. And so they're down in the dumps. And you can have a little situational depression there too, but we're not going to go there. But you're really sad. The person's really sad. But what happens is that in that period, you can, maybe they eat something that they really enjoy and they have a moment of like, oh yeah, this is good, thanks. They're not ecstatic, but they can appreciate it. Maybe someone makes a joke and they giggle a little, and then they go back to being sad. But there's a way that they can still find some little bits of joy, happiness, contentment, satisfaction, little pieces in there. They can still find joy in things they used to like to do. And that's the biggie with depression. There's no interest even or joy or anything in things that used to bring happiness. So maybe your partner used to love playing the guitar and now they just don't want to play the guitar no matter what. When they do, they say it doesn't do anything for them. They don't feel happy or good doing it. That's really one of the main ways you know. There are criteria that we use. I'm so itchy today, sorry. There's criteria that we use, licensed professionals, psychologists, etc., for when someone is having a diagnosis. And I'm not going to go over all that right now, but I will point out some important ones. And one is also with depression, there's a real difference in sleep usually, or appetite, or both. That could be an increase in appetite or a decrease in appetite and losing weight. That could be an increase in sleep, sleeping like way too much, or not being able to sleep at all. Either of those just, poles is a problem. Fatigue is another issue that's sort of chronic and just that sort of feeling with depression. Not being able to concentrate or plan, think ahead, really a lot of indecisiveness often with folks who are really depressed ongoing. And one of the things is that depression, the symptoms have to last longer than 2 weeks for us to make that diagnosis, and they need to have sort of a bunch of things. You can't just have one thing and be considered depressed. One of the things that's not like on the list of what we check off, but which is common, Well, mood swings is, so I guess it's close. Are angry outbursts. Angry outbursts, someone who just goes from 0 to 60, who flashes quite a bit, that's often a sign of depression, especially if you're noticing that with some of the other pieces. And so mood swings are one of the things we talk about as a diagnostic criteria. And the symptoms have to, again, be lasting more than 2 weeks, and you have to have 5 of the 8, I think, that we have. But you can get the idea from this. And obviously one of the biggies is being suicidal, talking about hurting themselves, talking about maybe even having a plan or no plan. But people who are sad don't talk about killing themselves. It's a very different thing. So those are the big differences between depression and sadness. And whether someone's just having a tough time, you got to wait it out with them. So when someone's having a tough time, and they're having trouble snapping out of it, it's okay to say that. To say, hey, let's, you got to snap out of this a little. What's going on? If you say it to someone who's depressed, not good. You can say to someone who's sad, I know you're really sad about your mom's passing, and I know how close you were, but she would not want you to be sitting here alone all day eating or whatever they're doing. And not playing with your children and not going to work. She would hate to think that that's her legacy, that that's what you're doing in response to that. And there's like a reasoning you can do, an encouragement. All those things really work when someone is sad, or can work when someone is sad. They don't work with depression, and as a matter of fact, they can often make it worse. So what do you do? What can you sort of be sure about doing? And the first things first is get thee to a doctor. Yeah, to a professional, to someone who's trained at this. Sometimes people who are truly depressed do not want to go see anybody. They're like, I'm not having it. So what you can encourage, and should, is for them to at least see their primary care physician, because they actually might have a medical condition that is causing the depression. So it's actually a medical condition that's the issue. They really should have, a physical, let's rule out, you can have chronic fatigue because you have chronic fatigue syndrome, let's be real, or something even more horrible. So that should be ruled out, and you should talk about that. And it also can, you can also have a doctor really decide whether or not, sometimes they'll ask the right questions, and sometimes all these depression symptoms can show up and they're actually a substance abuse problem. You might not think that your partner drinks that much or smokes too much pot or whatever, because you just don't think in those terms, or you might not be noticing how much they're actually using. But blood tests can show that better. Maybe I've had many a client come back and hear that they had elevated liver enzymes. They did not think they drank too much, nor did their partner. But if you have elevated liver enzymes, you're drinking too much. So some of these things can be contributing, and you want to, we call it ruling out. You want to rule those things out to make sure you're really dealing with depression versus something else. And if you can get them in that door and the primary care physician sees that they're really depressed, they can then get referred to a psychologist or a psychiatrist. And that can be really helpful, coming from them and not you, coming from the health professional and not you. So I will say that. The other thing you can do for sure, so that can be if someone's having a hard time or not, just to get to a doctor and get some help. The keeping your home healthy. You can have total control over that, so that's a good thing. And again, whether someone's having a hard time or whether they're depressed, it would be great to really focus on having healthy parameters in your home. So that means, having routines, wake-up times, bedtimes that are very regular, meal times, that you're eating nutritious meals, that there's a lot of nutritious food in the house, that you get rid of a lot of the junk food and things like that. That you maybe get out, talk to your partner, hey, let's go for a walk, let's get out of the house, let's maybe they'll go for a hike or a bike ride, maybe they'll do some actual exercise, which would be wonderful, but maybe they'll at least window shop, maybe say, hey, let's go downtown and we'll just walk around a little bit, we'll just window shop, just to get them out of the house, just to sort of get moving. But these are all things that are part of sort of a healthy home, a calm, stable environment at home. Just really focus on that as much as you can, because again, helps no matter what is someone's going through. It could really be a positive thing. The other thing is to ask collaborative questions. And these are really important because it can be a hard line between being codependent to being doing too much and being supportive. Supportive is great. Codependent's not. But if someone is severely depressed, we often want to, might need to help get them to doctor's appointments or make sure they're taking their meds or things like that. It's a sticky wicket. It's a slippery slope there. So I don't want to get too far down that road right now. But again, if you can get them to the doctor and start there, someone else is starting to intervene with them instead of it just being you as the partner. But asking questions is really the first thing anyway. So let's say they've been depressed before. Let's say they've had this sort of thing before. And by the way, if someone's been actually depressed before, whatever you're seeing is probably depression. But if you're not sure, you could say, hey, you've been down before. You've had, your grandparent died before. How'd you get through that? What helped you the most getting through that? Is there anything I did before that really helped you and had you feeling supported when you got through that other, whatever that thing was that made them sad or depressed? And that is a great place to start, because now you're not being so codependent, you're being supportive. They're coming up with some good ideas, which is really what you want, and you're on the right track. You can also just ask about, hey, if there's, I see you don't feel great. Is there one thing I could do that would help move the needle to helping you feel just even this much better today? What would that be? Is there one thing I could say that would really help and have you feeling differently? These are all collaborative questions. This is showing that you're in it with them. It's not a them problem, it's a we problem, because it's your partner. And this could work for anybody, by the way, but it's always nice for people to feel like you really have their back and you're in it with them and they're not alone. So as you might imagine, right? You can ask about, hey, just be careful with certain questions I'm about to say. You don't want to appear interrogating, but you could ask, have you eaten today? Hey, did you sleep last night? You seem to be tossing and turning. How many hours do you think you got? These are, again, great places to start, and to, you might ask, like, well, is there something I could make that would feel like get your appetite revved to eat something if they haven't been eating? Is there anything I shouldn't keep, if they're eating nonstop, is there anything you don't want me to keep in the house that's becoming a problem? Any of these things help. These are all collaborative questions, great place to go, and a great place to help you know that you're not getting too codependent or anything like that. And the last tip I'm going to tell you is probably one you can guess, which is take care of yourself. You know that line, you can't fill a glass with an empty pitcher, right? You can't do that. You've got to be okay. And I always say this, if you're really believing that your partner or your best friend or whoever this is needs therapy and they won't go, you should go. I know, you don't like to hear that, but that's what should happen. If they won't go, you should go. And even if they do go, if it's really bad and it's a bad clinical depression, you should get support too. It's a lot to deal with. It's a lot to live with. And it might be recurring, all kinds of things. So you really want to know that you know what's the right thing to say, how to be acting. Are you being too codependent? Are you not supportive enough? What is it? It's a hard line. Even us therapists cross it sometimes and don't do a good job. And we're trained and we have experience. So you can imagine what it is to be a partner with someone like that. So make sure that you're taking time for yourself, that you're getting to therapy if you need to, that you're getting sleep. If your person is tossing and turning all night and up and down because they're depressed, you might want to sleep in a different room because you need to sleep. You need to get up feeling refreshed so that you can be a loving, supportive, fabulous partner with them. So that's it. Those are my tips. This is the ways to tell the difference between sadness and depression. I'm Dr. Abby Medcalf. I help people create love, joy, ease, and connection in every relationship.